In the realm of healthcare, where the sanctity of health and well-being reigns supreme, the significance of maintaining a hygienic and safe environment cannot be overstated. A critical facet of this endeavor lies in the effective management of offensive waste, a multifaceted issue with far-reaching implications. From safeguarding the health of patients and healthcare professionals to upholding the integrity of our environment, the responsible handling of offensive waste emerges as a paramount concern. The ramifications of neglecting proper offensive waste management protocols are profound, potentially leading to outbreaks of infectious diseases, environmental contamination, and reputational damage to healthcare institutions. Therefore, a comprehensive understanding of offensive waste, its associated risks, and the best practices for its management is essential for all stakeholders in the healthcare ecosystem. Offensive waste encompasses a broad spectrum of waste materials generated within healthcare settings that, while not necessarily infectious, have the potential to cause offense due to their unpleasant nature. This category encompasses items that are contaminated with bodily fluids, such as blood, urine, or feces, as well as materials used in medical procedures that may have come into contact with these substances. Examples of offensive waste include soiled dressings and bandages, used sanitary products, discarded medical equipment such as gloves and syringes, bedpans and urine bottles, and human tissues or bodily fluids. The improper disposal of offensive waste poses a significant threat to public health, environmental sustainability, and the reputation of healthcare institutions. When offensive waste is not handled and disposed of appropriately, it can contaminate water sources, soil, and air, potentially leading to the spread of infectious diseases. Moreover, improper offensive waste management can result in hefty fines and penalties for healthcare facilities, tarnishing their image and eroding public trust. In extreme cases, it can even lead to legal action and prosecution. The environmental impact of improper offensive waste disposal is equally alarming. Effective offensive waste management requires a multifaceted approach that encompasses segregation, storage, and disposal. Segregation, the first line of defense, involves separating offensive waste from other waste streams at the point of generation. This is typically achieved through the use of color-coded bins and containers clearly labeled with the type of waste they are intended for. Storage of offensive waste, once segregated, must adhere to strict guidelines to prevent contamination and minimize risks. Offensive waste should be stored in designated areas, away from food preparation areas and patient care spaces. Finally, the disposal of offensive waste must be carried out by licensed waste management contractors who follow stringent protocols to ensure the safe and environmentally sound treatment of this waste stream.